Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. Which information should the nurse teach? 1. Increase the amount of sprays used until the desired effect has been reached. 2. This type of medication can cause rebound congestion if used too long. 3. Alternate the oxymetazoline with a saline nasal spray every 2 hours. 4. Place the oxymetazoline nasal spray in a vaporizer at night for the best results. The correct answer is 2. This type of medication can cause rebound congestion if used too long. Oxymetazoline is a nasal decongestant. Oxymetazoline is recommended for short-term relief of nasal congestion for clients older than the age of 6. This medication is for short-term use only. Longer use can cause a rebound congestion that can be difficult to resolve. Oxymetazoline should be used every 10 to 12 hours only. Using it more often increases the chance of developing a dependence on the medication and rebound congestion. Oxymetazoline nasal spray is to be used intranasally. It is not an additive for a vaporizer. To reduce the risk of hypoglycemia in a full-term newborn weighing 2,900 grams, what should the nurse do? 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. 2. Feed the infant glucose water every 3 hours until breastfeeding well. 3. Assess blood glucose levels every 3 hours for the first 12 hours. 4. Encourage the mother to breastfeed every 4 hours. The correct answer is 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. Hypothermia in the neonate is defined as a temperature below 97.7 degrees Fahrenheit. Cold stress syndrome may develop if the baby's temperature is below that level. A healthy neonate does not need supplemental feedings, and if supplements are needed, they should be either formula or breast milk. There is no indication in the STEM that glucose assessments are needed for this baby. Babies should be breastfed every 2 to 3 hours. Feedings every 4 hours are not frequent enough. It is important for the student to know that a baby weighing 2,900 grams is an average-sized baby. They range 2,500 to 4,000 grams. In addition, because no other information is included in the STEM, you must assume that the baby is healthy. The answers, therefore, should be evaluated in terms of the healthy newborn. Hypoglycemia can result when a baby develops cold stress syndrome because babies must metabolize food to create heat. When they use up their food stores, they become hypoglycemic.
An older adult woman who has left-sided paralysis because of a brain attack is being cared for by a daughter in the home in which the daughter lives with her husband. The home care nurse interviews each member of the family separately, based on the significant information in each interview, which is the most important initial nursing intervention. 1. Be sensitive to the client's cultural beliefs. 2. Arrange respite care for the client's daughter. 3. Reinforce the daughter's responsibility to care for her mother. 4. Encourage the husband to help his wife with the care of his mother-in-law. The correct answer is 1. Be sensitive to the client's cultural beliefs. Rationale. Beliefs and values usually are held long-term and are ingrained within one's view of self. It is essential that nurses respect a client's beliefs and values, particularly for non-traditional healing practices, as long as they are not harmful to the client. Demonstrating respect and a non-judgmental attitude will help promote a trusting nurse-client relationship. In option 2, arranging respite care for the daughter is premature at this time. This may eventually become necessary. Option 3 is an inappropriate intervention by the nurse. Only the daughter can come to the conclusion that it is her responsibility to care for her mother. Option 4. This is not the priority. This intervention may be done after a discussion with the client, daughter, and husband. A nurse is assessing a 4-year-old child's growth and development. Which activity should the nurse expect the child to be capable of performing? Select all that apply. 1. Dresses self. 2. Uses toy tools. 3. Hops on one foot. 4. Rides a 2-wheel bicycle. 5. Swims using the freestyle stroke. The correct answers are 1. Dresses self, 2. Uses toy tools, and 3. Hops on one foot. Rationale. Preschool-age children have the fine motor skills to open and close zippers and buttons. Preschool-age children have the motor skills necessary to manipulate a toy tool, such as a hammer. Preschool-age children have the gross motor skills and balance to be able to hop and skip on one foot, balance on one foot, and perform a broad jump. Preschool-age children do not have the strength and balance to ride a two-wheel bicycle. A preschooler usually can ride a tricycle. School-age children, not preschool-age children, usually are able to ride a two-wheel bicycle. Preschool-age children do not have the strength and coordination to swim using the freestyle stroke. Some preschool-age children are able to do the doggy paddle. School-age children, not preschool-age children, usually are able to swim using the freestyle stroke. A nurse is facilitating a mother's class, and the women begin discussing experiences that reflect the intellectual development of their children. Each woman describes a situation that reflects one of the stages of Jean Piaget's theory about logical thinking. Place the situations described in order, beginning with the sensor-motor stage and ending with formal operations. 1. My son touched the radiator and got burned. He'll never do that again. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. The correct order is 1. My son touched the radiator and got burned. He'll never do that again. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on a debating team in school. We go to inter-school meets. Rationale. The sensor-motor stage, birth to 2 years, is governed by sensations in which simple learning takes place. It progresses from reflex activity through repetitive behaviors to imitative behavior. These children are curious, experiment, and learn primarily through trial and error. The preoperational stage, 2 to 7 years, involves thinking that is concrete and tangible. These children cannot reason beyond the observable. Also, their thinking is transductive. That is, knowledge of one characteristic is transferred to another. The concrete operational stage, 7 to 11 years, reflects an increasing ability to use symbols and understand relationships between things and ideas. Judgments are made based on what they reason rather than just what they see. Also, they develop the concept of conservation. That is, physical remain the same even though outward appearances may change. The formal operational stage, 11 to 15 years, involves thinking that is abstract, theoretical, philosophical, and hypothetical. Thinking is characterized by flexibility, adaptability, and drawing logical conclusions.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A hospice nurse is providing emotional support for 8 young children of a dying mother. At which age do children first recognize that death is irreversible, universal, and natural? 1. 9 years of age. 2. 6 years of age. 3. 15 years of age. 4. 12 years of age. The correct answer is 1. 9 years of age. Rationale. A 9-year-old child has a more realistic understanding of death than a younger child and recognizes that death is universal, irreversible, and natural. A 9-year-old child has a beginning knowledge of his or her own mortality and may fear death. A 6-year-old child is developing an understanding of the differences among the concepts of past, present, and future. A 6-year-old child believes that death is temporary, can be caused by bad thoughts, and may be a punishment, and that magic can make the dead person alive. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 15 years. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 12 years.
The client diagnosed with a severe acute exacerbation of Crohn's disease is prescribed total parenteral nutrition, TPN. Which interventions should the nurse implement when administering TPN? Select all that apply. 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. 3. Assess the peripheral IV site every 4 hours. 4. Check the TPN according to the 6 rites prior to administering. 5. Encourage the client to eat all of the food offered at meals. The correct answers are 1. Monitor the client's glucose level every 6 hours, 2. Administer the TPN on an IV pump, and 4. Check the TPN according to the 6 rites prior to administering. TPN is 50% dextrose. Therefore, the client's blood glucose level should be checked every 6 hours. Sliding scale regular insulin coverage is usually ordered. TPN should always be administered using an IV pump and not via gravity. Fluid volume resulting from an overload of TPN could cause a life-threatening hyperglycemic crisis. TPN must be administered via a subclavian line because a peripheral line will collapse as a result of the hyperosmolarity of the TPN and phlebitis may occur. The client with severe acute exacerbation of Crohn's is NPO to rest the bowel. When on TPN, the client is usually NPO because the TPN provides all necessary nutrients. Therefore, the nurse would not encourage the client to eat food.
The 44-year-old female client presents to the emergency department diagnosed with a stroke. Which of the client's current medication regimen is a risk factor for developing a stroke? 1. Propranolol. 2. Furosemide. 3. Estradiol/norgestimate. 4. Metformin. The correct answer is 3. Estradiol/norgestimate. Rationale: propranolol, a beta blocker, is administered for cardiac dysrhythmias and hypertension and for migraine headache prophylaxis. The medication could help prevent a stroke by lowering the blood pressure. Furosemide is a loop diuretic. Loop diuretics have an indirect ability to lower the blood pressure by decreasing the volume of fluid in the body. This would decrease the risk of a stroke. Estradiol/norgestimate is a combination hormone used to prevent conception. Combination oral contraceptives have been associated with venous and arterial thromboembolism, pulmonary embolism, myocardial infarction, and thrombotic stroke. Adverse reaction to metformin glucophage, a biguanide, is lactic acid buildup, not stroke.
The nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. 1. Order an infusion pump for the client. 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. 4. Check for allergies to cephalosporin. 5. Ask the client his or her date of birth. The correct answers are 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. And 5. Ask the client his or her date of birth. The head of the bed is elevated for the client to be able to swallow the medication. The nurse must check the medication administration record with the client's ID band to ensure the correct client is receiving the medication. The Joint Commission requires that 2 patient identifiers be used to determine the right patient. Most healthcare facilities use the client's name and date of birth as these identifiers. An IV pump is not needed. Esomeprazole is a PPI, not a cephalosporin. Cephalosporins are a class of antibiotics.
Which intervention would be most likely to assist a client with hypertension in maintaining an exercise program? 1. Giving the client a written exercise program. 2. Explaining the exercise program to the client's spouse. 3. Reassuring the client that he or she can do the exercise program. 4. Tailoring a program to the client's needs and abilities. The correct answer is 4. Tailoring or individualizing a program to the client's lifestyle has been shown to be an effective strategy for changing health behaviors. Providing a written program, explaining the program to the client's spouse, and reassuring the client that he or she can do the program may be helpful, but are not as likely to promote adherence as individualizing the program.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is teaching a mother how to care for her 3-day-old son's circumcised penis. Which of the following actions demonstrates that the mother has learned the information? 1. The mother cleanses the glands with a cotton swab dipped in hydrogen peroxide. 2. The mother covers the glands with antifungal ointment after rinsing off any discharge. 3. The mother squeezes soapy water from the washcloth over the glands. 4. The mother replaces the dry, sterile dressing before putting on the diaper. The correct answer is 3. The mother squeezes soapy water from the washcloth over the glands. Squeezing soapy water over the penis cleanses the area without irritating the site and causing the site to bleed. Hydrogen peroxide is not used when cleansing the circumcised penis. Antifungals are not indicated in this situation. Dry dressings are not applied to the circumcised penis. It is, however, usually recommended to liberally apply petroleum jelly to the site before diapering. The petroleum jelly may be applied directly to the penis via a sterile dressing or via a petroleum jelly-impregnated gauze. The circumcised penis has undergone a surgical procedure, but to apply a dry dressing is potentially injurious. If the dressing adheres to the newly circumcised penis, the incision could bleed. You should be aware that with routine cleaning, as cited previously, circumcisions usually heal quickly and rarely become infected. The female client is being admitted to a medical unit with a diagnosis of pneumonia. Which intervention would the nurse implement? Rank in order of performance. 1. Start an IV access line. 2. Administer the IVPB antibiotic. 3. Teach to notify the nurse of any vaginal itching. 4. Obtain sputum and blood cultures. 5. Place an identity band on the client. The correct order is 5. Place an identity band on the client. 4. Obtain sputum and blood cultures. 1. Start an IV access line. 2. Administer the IVPB antibiotic. And 3. Teach to notify the nurse of any vaginal itching. The laboratory technician who will draw the blood cultures will need the band to identify the client before drawing the specimen, and the nurse will need the band before administering the medication. Checking for the right client is one of the 6 rights of medication administration. Cultures are obtained prior to the initiation of antibiotics to prevent skewing of the results. An IV line must be initiated before the nurse can administer IV medications. IV antibiotics should be administered within 1 to 2 hours of the order being written. This should always be considered a now medication. Superinfections are a potential complication of antibiotic therapy. Vaginal yeast infections occur when the good bacteria are killed off by the antibiotic. Diarrhea from destruction of intestinal flora is also a possibility.
Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 2. Lessening of fatigue. 3. Improvement in blood sugar levels. 4. Increase in urine output. The correct answer is 1. The effect of a beta blocker is a decrease in heart rate, contractility, and afterload, which leads to a decrease in blood pressure. The client at first may have an increase in fatigue when starting the beta blocker. The mechanism of action does not improve blood sugar or urine output.
A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2. Monitoring the client's vital signs, and 3. Notifying the physician of the client's symptoms. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician. Which factor is unique to malpractice when comparing negligence and malpractice? 1. The action did not meet standards of care. 2. Inappropriate care is an act of commission. 3. There is harm to the client as a result of the care. 4. There is a contractual relationship between the nurse and client. The correct answer is 4. There is a contractual relationship between the nurse and client. Only malpractice is misconduct performed in professional practice, where there is a contractual relationship between the client and nurse that results in harm to the client. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The client must have sustained injury, damage, or harm with both negligence and malpractice. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.